talk about hormones today. Now, this subject is important for men and women because obviously we usually live together in some fashion, and hormones affect our everyday life. Men, if you have a wife or a better half that has problems with hormones, this is very important for you to listen to also. At age 30, our hormones start to decline. So, when our hormones start to decline at age 30, you can imagine what you're going to be like at 50 without any hormones. So, we also have different issues that occur within us where we have hysterectomies, tubal ligations, ovary problems, tumors to be removed that can affect our hormone-producing organs. Compounded with the fact that you start losing your hormones at age 30, this is a very serious issue in our society. What happens to the women when we start losing our hormones? First of all, sleeplessness, anxiety, depression, fatigue. How many of you have those symptoms? Yes. Everybody has got some of those symptoms. We start turning into our moms and we start feeling crazy and we don't know what to do with ourselves. So what happens? You get on antidepressant, anti-anxiety, and any type of medication that can actually make you feel better. But what we need to do is actually fix the problem, and the problem is your decreased production of hormones in your body. Back in the 80s and 90s, we had the hormone replacement therapies that got the bad rep of the increased cancers in our bodies, so we stopped doing that. So what happened was then we had our women all going crazy and getting depressed and started getting on anti-anxiety and antidepressant medication. What we have now discovered is there are ways to replace the hormones in our bodies with a more natural substance. Bioidentical hormones are made to be identical to the hormones that are being produced in our body. They're actually derived from soybeans and wild yams. They're taking the estrogens out of these products and putting them into our bodies. The neat thing about this is not actually how they're being made, but how we're deciding what amount you need as a person. We are going to, in our clinic, do a saliva test or a hormone test to determine what level your body has. Okay? So if you're deficient in estrogen and progesterone differently than the way I'm deficient in it, we don't want to just give you a pill for the same pill that I'm taking. So what we're going to do is figure out what level you need. Once we figure out what level you need, we're going to call it into a compound pharmacist that's going to make a pill or a cream that's specific for your body, which is very important because we want to treat your body, not the whole mass society's body. If you've ever been pregnant and you remember how great you felt throughout the pregnancy, then you had the baby and you felt like you were going to kill everyone. Well, what happens is you had that lovely progesterone going throughout that whole pregnancy, and then it dropped off after you had that baby. So that's why you have all these symptoms after you have a child. If you've never been pregnant, don't worry about it, but that progesterone is what gives you the happy feeling. So if you're starting to feel a little depression in life, maybe we need to check your progesterone. Once we do the baseline testing to figure out what's going on with your body, we're going to call it into a compound pharmacist. A compound pharmacist is a person that actually makes the cream or the pill for you. There's usually 2 or 3 in Charleston that we work with, and they're going to make the pill. You're going to come back to us and definitely monitor your signs and symptoms and see how it's doing. If you need a lesser or higher dose, Patricia Coleman, our nurse practitioner, will modify that as needed. One of the number one concerns is, does insurance cover these drugs? No. The reason why is because drug companies can't patent these, so therefore they're not making a bunch of money off of them. So how much do they cost? Usually around $35 a month. I think $35 a month is worth the sanity for you to be able to sleep at night, have energy to go out with your day, and not have the feelings of anxiety and depression that can occur when you start losing your hormones later in life, not to mention the hot flashes. Okay, so if you have any questions or concerns, please call the office and we can talk with you further, and we also set you up an appointment with Ms. Patricia Coleman, who can tell you a little bit more about the bioidenticals.